Good morning everyone, my name is Shohini Datta. I am a student of Shantiniketan Shivaniketan Nursing Institute and I am going to discuss about range of motion exercises. So first of all we have to know about the meaning of range of motion exercises. Range means within reach and motions means is movement. So in short we can take range of motion means exercises we do within our reach. So next is definition. The definition of the range of motion exercises is it is a physical activity. It improves a particular joint movements without causing any pain. Next, we have know about the indication of ROM exercises. Indication of the ROM exercises is we give these exercises to the comatose patient, paralytic patient, and weight-ridden patient because it improves our blood circulation throughout the body. And next is as a re-education exercises and for relaxation. Next, we have know about the contraindication of ROM exercises. Patient after tears, surgery and fractures, we cannot advise the ROM exercises. Next, we will know about the contraindication of ROM exercises. We cannot advise patient with after surgery, fractures or tears and in acute arthritis or joint pain and swelling or effusion of the muscles. Now I am going to discuss about the benefits of ROM exercises বা শারীরিক কার্যকলাপের উপকারিতা। ফার্স্ট জানবো জয়েন্টের গতিবিধি বৃদ্ধি করে। সেকেন্ড, একটি পেশির সহনশীলতা এবং শক্তি বৃদ্ধি করে। 3, চলাফেরার সক্ষমতা প্রদান করে। 4, চলনের স্বাধীনতা প্রদান করে। 5, বেদনা হ্রাস করে। 6, দৈনন্দিন জীবনযাত্রার কার্যকলাপে অংশগ্রহণ বৃদ্ধি করে এবং 7, জয়েন্টের নমনীয়তা বৃদ্ধি করে। নেক্সট জানবো about the purpose of the ROM exercises. It increase our cardiopulmonary function and then reduce blood glucose level, reduce our weight and reduce blood pressure level. Next, we are going to discuss about the medical abbreviation of joints movement. First, abduction. Abduction is the movement of the joints towards the midline. And then adduction. Adduction is the movement of the joints outward the midline of the body. Next is flexion. Flexion is the bending of the body part. Then extension is the straightening of the body part. Then rotation. Rotation is the turning of the joint. Next is internal rotation. It is the turning of the joint towards inwards. And then is external rotation. It is the turning of the joint outwards. Next, I am going to demonstrate what are the ROM exercises we are going to do in regular days or in our everydays. Now I am going to demonstrate some ROM exercises. These are first head and neck. This is flexion, extension, hyperextension. Flexion, extension, hyperextension. Lateral flexion, lateral flexion. Lateral flexion, lateral flexion. Then it is shoulder, elbow and wrist. First, flexion, extension. Flexion, extension. Abduction, adduction. Abduction, adduction. And rotation of the shoulder. Next is elbow. This is flexion, extension. Flexion, extension. Pronation, supination. Pronation, supination. Next is wrist. Wristed মধ্যে এখানে flexion, extension, hyperextension. Flexion, extension, hyperextension. Then rotation of the wrist. Next is thumbs and fingers. This is flexion, extension. Flexion, extension. Then fingers. Flexion, extension. Flexion, extension. And opposition of the hand. Opposition of the fingers, opposition of the fingers, opposition of the fingers and opposition of the fingers. Next is spine. Lateral flexion, lateral flexion. Lateral flexion, lateral flexion. Next is hip, elbow and ankle. First, flexion, extension, flexion, extension, abduction, adduction, abduction, adduction. Next is elbow, flexion, extension, flexion, extension. Next is ankle. First, flexion, extension, hyperextension. Flexion, extension, hyperextension. Then inversion, eversion. Inversion, eversion and rotation of the ankle. Rotation of the ankle. আজকে আমার আলোচ্য বিষয় ছিল রেঞ্জ অফ মোশন বা শারীরিক কার্যকলাপ। আশা করি আমি আপনাদেরকে এই বিষয়ে বিশেষ তথ্য দিতে সক্ষম হয়েছি। যদি আপনাদের এই ভিডিওটি ভালো লেগে থাকে তাহলে অবশ্যই লাইক, কমেন্ট এবং সাবস্ক্রাইব করবেন। ধন্যবাদ।